Guys, you're welcome to another edition of my program called Health Talk with Twin Nikki. As you guys know, if you are following me on my main page, which is Health Talk Queen on TikTok, my business page Health Talk Queen One on TikTok, and also Instagram Health Talk Queen, and YouTube Health Talk Queen One. Please follow, turn on the post notifications so you can get notified when I drop a new video. Now it's October and it's breast cancer awareness month. Okay, I am a strong supporter of breast cancer awareness month. That's why I put on pink, and it's pink month, okay, for the queens out there that are survivor of breast cancer, and for those who have rest on, may their soul continue to rest on. As a nurse, our major priority is to educate people out there about breast cancer, and the only way we can do it is education. So I'm going to be doing more when it comes to education with breast cancer. If this video might turn to part 1 too, let's go. I have a previous video that I did last year that I put on nursing uniform pink, that I dedicate to a friend of mine who passed away with breast cancer. She is I would say she's the solid founder of HTQ. She's my reason why I surfaced on TikTok, and trust me, I've never regretted it. My obligation and my pledge to her, is to continue to hold on to HTQ Health Talk Queen platform on TikTok, and that's why I'm still holding on, and I thank God that our soul is still guiding me throughout till today. Okay, and also I am a strong supporter of American Breast Cancer Association in United States. I support them, and also all over the world. Okay, so let's go. For those people that are struggling with breast cancer, hold on to your faith. You can make it. You can do it. You just have to keep on to your faith, to the disease process. Keep doing everything you can. You will survive it in Jesus' mighty name. Now let's go. So what are the typical signs that you can see when it comes to breast cancer? And trust me, before I go further, I'm going to demonstrate how we can do breast self-examination in another video. Okay, so watch out. So what are the signs that when you see typical sign of this, you run to your doctor for further testing? Okay, sign like new lumps in your breast area. When you find new lumps in your breast area under your armpit, please consult your doctor. The next one is thickening or swollen part of the breast. If you find thickening or swollen part of the breast, run to your primary care doctor. If you find redness, flaky skin, and around your nipple area or the breast area that is just not right, your instinct is telling you this is not right, please consult your primary care doctor. If you see pulling in the nipple area or pain around the nipple area, pulling in the nipple area or pain around the nipple area, go for further testing. If you have discharge, when it's not breast milk, you have discharge in the nipple area, most especially blood or pus, please consult your doctor immediately for further testing. If you have irritation or dimpling around the breast area, please consult your primary care doctor immediately. Any change in breast size, is your breast, any change. If you see any change, please run to your doctor or in breast size. So you always make sure you look at it very well. Now, let me further explain something. If you are above 40 years old, there is a procedure that you need to do, especially if you have history of breast cancer in your family. It's called mammogram. Mammogram is a yearly thing that you need to do, especially if you have family history. Even if you don't have family history of cancer, it's expected of you to do it. It's So talk to your doctor about making sure you do this mammogram. Sometimes some insurance wait till they are 45 years old before they start this process. But if you have history, they start it earlier. It's very important. Now, all the signs and symptoms that I mentioned, if you have it and is detected in mammogram, they will send you for further testing, which is ultrasound. Now, if ultrasound picked it, then they would send you further for biopsy. There's what we call biopsy. They will go inside, take a tissue of that lumps and test it to see if it's cancerous test or just benign. Now, if your mammogram result said benign, that doesn't mean you have cancer. It might be your breast that is, maybe you are close to your menstrual period or your breast tissue. But it's better that they discuss the result with you and do further testing to make sure it's not cancer, because guess what, cancer is painless. That's what makes it even more dangerous. You don't feel the pain until it gets to the stage whereby yes, you can't take it anymore, which is stage 4. We have different stage 1, 2, 3, 4. Okay, so now another thing is what is the best time to do breast self-examination? Breast self-examination can be done in the morning, especially after shower, because your body is relaxed. That's where you can detect. So what I do personally as a nurse, and I teach my people, is make sure in the morning you do your breast self-examination facing the mirror. That's where you can see the color, the shape, the discharge. You can see if you're doing it properly, and your body is relaxed. That's the best time to do the breast examination, in the morning after shower. So do it every now and then. I'll be talking more about prostate cancer. Now, prostate cancer for men is the same thing, that you have to make sure you check it every morning after shower. And the best person that can detect prostate cancer for you is your partner, because you do the do thing and thing do. So they know how the structure is. So when they see different changes, they will like, something is not right with this. Please go to your doctor for further checking. Just as breast cancer. Breast cancer, also the person that can detect it very well is your partner, because they do the do thing and the thing do. I don't want to say it because of TikTok. They are the best person to detect that. And once they detect it, please do immediate action by going to your primary care doctor. Okay, now let's continue. Can men have breast cancer? Yes, they can. I'm gonna be reposting a lot about breast cancer. I'll be reporting from the doctor, from the nurses who talked about breast cancer, which is Pink Month awareness. Okay, so you can further know that yes, men too can. So whatever I talked about, how to do self-examination, which I'm gonna do separate video for that, men too need to do it, so that if they detect it, they call their doctor. Men, I know you guys don't like to go to the doctor, but at this case you have to go to the doctor so they can, because it's an emergency. See, cancer can be prevented if you detect early and let them start treatment as soon as possible. Because once you can detect it early, they will start the treatment. Your chance of survival is very, very high. Very high. That's why we don't play when it comes to breast cancer or any form of cancer. Okay. Now, the next thing that I also want to talk about is education. Let's educate our teenager, our young adult, tell them that breast cancer is real. Show them video like mine, and also nurses, doctors video that educate us about breast cancer. Very important. Show them. Watch this video with them. Education is very powerful, and the only way you can get it is social media that talks about this with doctors and nurses out there, okay, and also healthcare provider out there, okay. And also, what is it? Breast cancer is real. We just have to keep informing ourselves. See the plus sign over there, hit it. I'll be dropping chart and information to back up all this I'm saying, okay. And then watch out for the video. Let's go to the video where I will demonstrate how to do breast self-examination. Take care and God bless you.